Alright, good afternoon. Today we'll be doing a health assessment on my friend here. We're gonna start off by have her introduce herself.
My name is Preacha.
Can I get your date of birth?
8/13/1997.
Do you know why we're here today?
Yes, to do a health assessment
Do you know where we are?
at a clinic.
Excellent. So, as we could see, the patient is alert, oriented, and cooperative. We're gonna now proceed by doing a general survey. Her posture is well aligned, symmetrical, skin even, no discoloration, skin color appropriate for ethnicity, posture are symmetrical. And now we're gonna ask her if she's experiencing any pain or discomfort.
No.
No pain or discomfort. Alright, Prisha, do I have your permission to touch you?
Yes.
Thank you. So now we're gonna begin by examining her head, palpating. We're gonna see if there's any asymmetry or any lesions, any bald spots, things of that sort. Skin looks pretty much intact on the scalp. There's no lesions, no bumps, no raised skin. Clean, well kept, neat. No rashes. Alright. Next, we're going to examine the client's facial features. We're going to examine cranial nerve 5 by having the patient give us a smile. Smile is symmetrical. Can you give us a frown? Frown is also symmetrical. Can you raise your eyebrows? Puff up your cheeks. Stick out your tongue, please. Side to side. Tongue movement is symmetrical. Next, we're going to have her resist my hands. Okay. Intact eyebrow movement, symmetrical. Frown was symmetrical. Smile was symmetrical. And cranial nerve 5 was intact. Normal facial sensation, strong. Now we're gonna also assess for temporal and posterior muscles. We're gonna have you clench down. Pretty even. Any pain when you clench down?
No.
Can you clench down one more time? Cranial nerve 7, equal bilaterally. Next, we're going to move down to the patient's eye. We're going to have the patient follow in 6 directions. Alright. Eye movements are symmetrical. Eye alignment is also symmetrical, no deviations from normal, no abnormalities present, no discharge, no teary eyes, no redness. Now we're going to examine no edema noted, any pain when I palpate.
No.
Next, we're going to go with the uncover test, see if there's any nystagmus. As I can see, the client's right eye isn't trying to compensate for the left one. It remains pretty symmetrical, continues to look straight. And the client's left eye does the same. Next, we're going to examine the client's iris. retinas and see if they react properly. And we're doing this to see if there's any neurological defects with the patient. Alright. The left pupil does contract. The left also does the same. No redness. The sclera is white. Now we're going to pull down the eyelid, the bottom portion of the eyes. The conjunctiva is pink. No discharge. We're going to examine the upper eyelids. Client does appear to have some mascara on. Eyelashes are evenly distributed. Alright, next we're going to proceed with a red light test. Alright. So patient's cranial nerve 3, 4, and 7 are moving smoothly in all directions. Pupils are equal, round, and they accommodate to light. Red reflex is also present. Next, we're going to examine the patient's ear, her ability to hear, and the structure, if there's any abnormalities present. Just a general survey first. There's no rash, redness behind the ears, pretty much intact skin, no dryness, no redness, intact skin. Next, we're going to palpate the pineal. No tenderness reported, no pain.
No.
Any pain?
No.
Any pain?
No.
So the structure is pretty even, the ears look pretty symmetrical. Next, we're going to assess the patient's ability to hear. Can you please hold down your right ear?
Oranges and apples?
That is correct. Now we're going to do the same thing on the other side.
Bananas?
Next, we're going to examine the client's nose, external nose, the nasal cavity, the sinuses, and cranial nerve number 1, the ability to smell. So looking at the nose, it appears pretty symmetrical. Now I'm about to begin by palpating the bridge of the nose. Any tenderness, pain?
No.
We're going to palpate the soft tissues. No tenderness.
No.
Even distribution on both sides. We're going to palpate the sinuses. No tenderness, no abnormalities.
No.
Any pain while I do this?
No.
Alright. So now we're going to proceed by examining the inner nose, the inner mucosa. Can you tilt your head up? Alright, clients did our patent and clear airways. We're gonna examine that by holding that one nostril. Can you breathe in? Breathe in and out. Clear airways. The inner mucosa was pink, moist. The sinuses were non-tender. Next, we're going to examine the patient's sense of smell. Can you please identify the smell?
Vanilla.
Vanilla, that is indeed correct. Next, we're going to examine the patient's lips, oral mucosa, the teeth, the tongue, the tonsils, the soft palate, and cranial nerve 6, 5, and 7, alright? We're going to begin by having you open your mouth, big and wide. All teeth appear to be intact. Gums pink, moist, no lesions, no redness. Tongue midline, we're going to have you stick out your tongue, move it side to side. Alright, strong tongue movement. Tongue is midline. Next, we're going to have her swallow. Alright, that is good. Next, we're going to assess her ability to test her taste. Salty. Excellent. So, sense of taste is intact. Her ability to swallow is there. There are no abnormalities present inside the mouth. Next, we're going to begin by examining the neck area. Palpating the trachea, I'm gonna have you swallow. No enlargements present. It is midline. Any tenderness or pain? No tenderness or pain noted. No enlargement. Now we're going to examine the client's lymph nodes, beginning with the pre-auricular. Any pain, tenderness?
No.
Post-auricular. Occipital. No nodules. No. Submandibular. Submental. Ocular. Anterior cervical. No nodules present. Posterior cervical. Non-clavicle. No nodules are present. We're going to assess a carotid pulse. Carotid pulse is +2 bilaterally. Next, we're going to examine the client's posterior and anterior chest. We're going to inspect for chest shape, palpate for expansion, percuss for resonance, and we're going to auscultate for clear breath sounds. We're going to start with the posterior. Can you please stand up? There was resonant presence, no abnormalities, no dullness. We're gonna then just inhale. Inhale. We're going to palpate it for expansion. Next, we're going to auscultate. Inhale. 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 Next, we're going to focus your attention on the anterior portion of the chest, and we're going to just palpate. Inhale, please. Any discomfort at all?
No.
Alright, we're going to proceed by auscultating. Inhale. 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 Alright, lung sounds are clear, no abnormal breath sounds are present. Next, we're going to examine the client's heart sounds, beginning with the aortic, pulmonic, aortic, pulmonary, Erb's point, tricuspid, and mitral valve. We're going to assess that for 60 seconds. And now the mitral valve for 60 seconds. Can you please just 60 seconds, got the timer. Alright, BMI was 60, S1s, S2 presence, no murmurs, no abnormal heart sounds. Next, we're going to proceed by examining the jugular vein distension on both sides. We're going to assess no extensions. No enlargements, overall pretty healthy. Next, we're going to examine the client's abdomen. Next, we're going to be assessing the renal, aortic, the iliac, and we're going to examine the abdomen after. So, starting with the aortic, we're going to palpate. Iliac. Renal. We're going to begin with this. no glorious presence, no abnormalities there. Femoral artery is right here, which we're going to defer. We're going to now palpate the popliteal. +2 popliteal pulses. Next, we're going to go to the posterior tibia. +2 pulses in the posterior tibia. Next, we're going to go to the dorsalis pedis pulse. +2 pulses over there. Can you please lower your lower extremities? Next, we're going to examine the abdomen. Skin looks intact, no dryness. A little bit of red bumps here. Skin overall intact. Next, we're going to auscultate the bowel sounds. Auscultate the aortic, the iliac, the renal, next we're going to percuss the panic. There was no dullness over the liver. So now we're going to go with palpating, light palpation. No tendons, no muscles. Deep. So there's no tenderness, masses observed or palpitating. Bowel sounds are active in all 4 quadrants. There's no dullness over the liver. And next we're going to examine the upper extremities. So we're going to begin by inspecting the clavicles. Alright. The shoulder blades, scapula, shoulders, palpated the joints, no tenderness.
No.
Tenderness, pain over your wrists, circular motion, range of motion is full. Next, we're going to have you shrug your shoulders, spin your neck around 360, the other way, shoulders up and down. Now against resistance, and now put your arms like this, and now pull. Strength bilaterally equal. Now we're going to test the reflexes of the bicep. The tricep. All there. We're going to palpate the bring the pulse. Brachial pulse +2 bilaterally. Next, we're going to go to the radial. +2 bilaterally. Next, we're going to go to the lower extremities. Can you stand up for me real quick? Examine repeat for me? Can you kick both legs? Alright, range of motion is active. Can you go like this with your hips? The other one. Okay, active. Next, I'm gonna have you kick up against. Can you push your legs? That legs, both at the same time. Behind. Alright. Strength is equal bilaterally. Next, we're going to examine the plantar reflex. Alright. Going down to the Achilles. Range of motion is intact. Next, we're going to go to the spine and face the camera. The spine is straight, erect. Can you extend backwards? Flexation, extension. Can you touch your toes? Can you move in a circular fashion? Your hips in a circular fashion. Range of motion is active. Can you go side to side? Alright, range of motion. Now we're gonna proceed with the heel to shin test. So if you could just, with your heel, go down, starting from your knee with both legs. Alright. Alright. Now I'm gonna have you close your eyes and put your hands up, and you're gonna tell me yes or no when you feel it.
Yes.
Alright,
Yes.
any sensation is there. Close your eyes. I'm gonna have you hold something and you're gonna identify if it is cold or hot.
Cold. Cold.
Okay. Next, we're gonna draw something on your hand. You're gonna identify what it is.
Number 8.
Mhm.
Number 16.
Mhm. Next, we're going to have you identify certain objects that are placed in your hand. Close your eyes.
Coin.
Mhm.
Keys.
Okay, excellent. One more.
Spoon.
Alrighty, excellent. Next, I'm gonna place something in your hand. You're gonna tell me the sensation you feel.
I can feel vibration.
You can feel the vibration. That is excellent. Next, we're gonna have you stand up. Close your eyes and put your hands up. Alright, it is there. Next, we're gonna have you walk towards the camera. Now, can you walk back with your heels? Alright, excellent. Can you walk with your tippy toes? Can you do a heel to toe walk? Excellent. Now I'm gonna have you close your eyes and you're gonna tell me if you feel the sensation and do you feel any pain?
Yes. 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 Yes.
Alright. Next, we're gonna have you open your eyes and where I point my finger, you're gonna point to it and then point back to your nose. So. Alright, excellent. And that was a complete head-to-toe assessment with Prisha Law. Thank you.